The practice nurse at the surgery, she contacted me several times prior to the actual procedure itself to tell me exactly what was going to happen. And also she provided me with lots of documentation for me to read. In terms of the first thing that I had to do, of course, is take a COVID test. Then the actual test itself was straightforward. All the nurses and the staff who I was in contact with wore full PPE, masks, gowns, the plastic face coverings, for example. So yeah, that was very, very good. Getting into the hospital, you had to sanitize. They gave you a mask if necessary. Then I went into the actual procedure would take place. The nurses there provided me with a gown. Throughout that whole process, they were wearing full PPE, gloves, gowns, masks, etc. So very, very safe. But more importantly, what they did was throughout the whole pre-procedure, before I actually went for the procedure, they told me exactly what was happening, what was going on, the timings, etc. Then when it came for me to go into the procedure itself, again, all the staff were wearing full PPE, including the consultants, the nurses. As far as I'm concerned, it was very, very safe for me as a patient. I didn't have any fears or anxieties in any way. The nurses and the doctors were telling me exactly what was going on. And I could also see what's going on through the TV screen, which was in front of me. Even post-procedure, they took me to the recovery room. Again, all the nurses were wearing full PPE. They were making sure I'm comfortable. And then at an appropriate time when they felt it was suitable, they said, fine, I think it's time to go home. The hospital, the clinical aptitude of the people are fantastic. They know exactly what to do. They put your mind at ease. They tell you step by step what's happening. I don't think there's any anxiety that I felt that I think anybody would feel by coming to the hospital. I think it's even safer to have a COVID test and to have the procedure in the hospital